Hello, this is David from DN Cognitive Counseling. Today we're going to be responding to a subscriber who wrote something pretty serious, and I think I want to address it, and hopefully by addressing and helping them, it may help others who are going through things that may be similar. This is a follow-up video to my video about relapse, a question that Mary asked. And Mary wrote two responses back that I'd like to address. The first response, and she writes, "Thanks for the shout out, David. I guess you can say I've been binging. Do I have to go through a detox process? Yes, but not from heroin. It's not that bad. The only thing is I noticed is this new drug that I've been experimenting with. It's not even giving me the high that I want, so I almost feel tempted to do even worse. Why do I feel this way? I can't even pinpoint what's wrong with me. The large group settings, meeting people, it makes me paranoid. I think people are following me. How do I make this go away?" I'm going to stop there for a minute. It continues, but I'll continue in a moment. I want to deal with a number of issues here that are incredibly important. First off, if you find yourself binging and that you recognize you need to go through a detox process, then please go through the detox process and do it appropriately. Detox is only a few days, and today they actually have outpatient programs that can allow you to do detox from an outpatient setting where you don't even have to go inpatient. Personally, I think inpatient is much better. It's much safer. It puts you in the situation where you can focus on your recovery and your time to actually get clean so that you're not having the issue of possibly relapsing or relapse triggers. So I'm of the camp and belief that an inpatient detox is better. But if you refuse to do the inpatient detox, then at least do the outpatient detox. Now, when you're not getting the high that you want, why are you tempted to do more or worse? The answer to that is very simple. Because when you're looking for that and you're not getting it, you will try to do more and more to get it, and even putting yourself in a worse position, hoping that will do it for you. This is the reason why drug addiction is so horrible. It's chasing something that really doesn't even exist. You're always looking for more and more and more, and never being satisfied and no satiation. So that's the answer to that part. So I hope that you'll take me up on that and enter a detox. That's number one. Now, the aspect of paranoia. Paranoia is a horrible feeling, and paranoia causes us to do a lot of damaging things because we become avoidant of things that could be helpful to us and give into paranoia. If you're recognizing you're paranoid, that's wonderful, and that's actually a strength. So you recognize there's something wrong with the way that you're seeing things and emotionally feeling about them. So if you have the fortitude and strength, then doing what's called in DBT skills, opposite action would be very helpful, which is I recognize this false feeling and I'm going to do the opposite action of what I'm feeling. And you'll find that you'll be in a situation that is safer, especially about people who are trying to help you. So I think the point of paranoia also is that you also want to be medicated if you need to be, and you have to take a look at whether or not the medications that you're on are actually effective or not. So seeing a doctor, seeing the medications that you're on, evaluating them is rather important. You go on to write, how do I make this go away so I'm not paranoid anymore and it doesn't affect my day-to-day life? As we all know, when you are getting a sponsor, it's not going to happen, I'm guessing to say, if I'm paranoid and I do not trust anyone. I don't need a TC or an inpatient program because, like you said, I'm just an addict, and that was staying abstinent. Right now, I'm not sure I even want or I'm ready to stop, but I don't really have a choice. I have to get a job if I want to keep using. I won't be able to get a job. Somebody said that I lack ambition. Is that part of depression? And the big problem that I have every time I want to stop using and try after a binge, I become super depressed. So Mary, what you're also expressing is something called ambivalence. On one hand, you see there are benefits to you stopping. On the other hand, there are other things you don't want to give up about using. It's not unusual for people who have substance usage to feel this way. Ambivalence is the keynote feeling of addiction. On one hand, you get a lot of pleasure in the beginning and then relief of pain later on in the addiction. And then it's just a matter of even just trying to keep up with less pain as it gets later. And that's part of the problem of addiction. But that need to use is very, very strong. And you do a lot to want to hold on to that. You also talk about the idea, I don't really have a choice if I want to get a job. And part of the issue is that you really do have lots of choices. You have choices whether you want recovery. You have choices whether you want to continue. You have choices whether or not you want to be in pain a lot longer. The choice is really yours, and you do have to understand that you're going to make a choice. You made a choice to reach out to me and type and write this all out. Somewhere inside of you, you want to get sober or at least stop the pain. My recommendation again would be to go to the detox first. If not inpatient, then at least outpatient. Get stabilized on medication that helps to deal with the paranoia. And that might take a little bit of time, depending on your history and how many times you tried different medications, or if you've ever tried before. But that time is well spent, and it will help you dramatically. At that point, getting a sponsor will be a lot easier, and working on the recovery process will be a lot easier, because paranoia does get in the way. You could, if you wanted to, go to an inpatient program that deals with psych and substance abuse at the same time. But again, that's a choice that you can make. It would be helpful to you if you chose that, and they may be able to find something quicker. But if you don't want that type of situation, still, the other things I recommended would still be a good idea. I don't think, from what you're describing, your issue is lacking ambition. I think that you have these other alternative issues that are causing you to have roadblocks in your life that do cause you to become super depressed. Because when you're using substances, depression is one of the side effects of addiction and usage over time. And I think that that's rather important. Now that was your first message. I'm going to address now your second message. I've literally lost jobs because of how bad the paranoia gets, and that's not something that a TC or NA meeting can fix. I mean, I can recognize that it's bad because I know whatever I'm doing is not even strong enough. I need something more, so that scares me. I never felt like I was indecisive on whether or not I want to stop using. This time I don't know what I want to do. Using drugs, getting high on binges, it's not appealing to me. Even while I'm getting high, it's not good enough. But then work a minimum wage job, actually less than minimum wage, and I'm feeling like there's a conspiracy behind it because it isn't good for me neither. It also doesn't help that I constantly feel like people are subliminally talking about me. The reason why I feel like this is because usually right after I do something, it gets brought up as a coincidence. It's like once or twice, but I feel like 24/7, 7 days a week. This is killing me. I always say that I'm paranoid, and I thought I married my stalker, which is the way I feel, and that he was controlling. And the EBT card, I usually make him empty in the exchange for cash when it comes. So when there was the other day, I got the impression that subliminally customers were coming in basically saying, depending on my attitude, is how his attitude is going to be and whether or not there should be consequences, which, by the way, I wasn't nice. He always said to me verbatim, wait till next month. I'll make them shut off everything. So how should I feel about this? Is the paranoia something that is able to be stopped? Now, Mary, the answer is yes, the paranoia could be stopped. The answer is yes, entering into a TC or NA can help a lot with a lot of these issues. First of all, you'll be able to bounce your reality orientation off people that you can learn to trust. If you ever think about this, where is your nose and where is your mouth? Your nose is right underneath your mouth. Why is it that you're the last one to know when you have bad breath? I call this the mouth and nose syndrome because what happens is you habituate to your own smell of your breath. Somebody else recognizes when you have bad breath right away. They're not habituated to it. And what the ability of meetings give you and a sponsor gives you is that they're far enough away from you where they're able to give you perspective on you in a way that you sometimes don't recognize. Plus, they've been there and done that themselves. So they're able to recognize the signs and symptoms very quickly about what you're doing to yourself. The aspect of not wanting to do certain things is helping to keep you stuck. But that's okay. You're recognizing it. You recognize you want more. You don't want that minimum wage job, as you said. The one thing about addicts in active addiction is they do the opposite of the real world. In the real world, you start off at the bottom and you work your way up. In addiction, you start off at the top and you work your way down, which as you're going through your addiction, you get less in your life. You lose more things. You work your way down from where you started. And it sounds to me, Mary, like you're recognizing you're working your way down and you don't like it. And that's a strength. You're stronger because you recognize that. There's a part of you, a strong part of you, that wants the help, which is the reason why you reached out. You know, going online and to a place and saying, I have this problem, and sharing what you shared, that takes a lot of strength. And I realize being anonymous makes it easier, but you don't need to do that. You could have left it as, I'm just going to sit and suffer. And you didn't do that. You reached out. That is a strength. So take a little bit more. Get yourself to that detox. Get the substances out of your system. Give yourself a little bit of time. Deal with the psychiatrist in terms of the paranoia. Don't give up and don't get frustrated because it doesn't change right away. That's normal. It takes a little bit of time. Work to develop the sober support network that you're going to need and people that you're going to be able to trust after that is done. And the other things that you're talking about will fall into place really easier in your life. And in my experience, I've seen that happen over and over and over again for people that have done the things they need to do. And again, I wish you the best. I hope that you'll follow. If you like this video, please hit like. If you didn't just subscribe to the channel and you found this helpful in any way, shape, or form, please subscribe. And most importantly, if you know anybody else who might be suffering with addiction and paranoia, please forward this because it may be helpful. Thank you.